Introduction to the project of unauthorized aliens in the U.S. and their access to healthcare. The introduction. For the introduction, we just know that over the past half century, immigration has impacted and transformed the demographic landscape of the United States of America. By 2008 alone, the foreign-born population has surpassed over 40 million individuals, which represent about 1/7 of the entire population alone. Immigrants and their offspring outnumbered today at around 70 million individuals, which is almost 1/4 per head. For the demographics and ethnic minority groups, Hispanics and Asian Americans weren't prevalent in the demographics 50 years ago, whereas now they represent the fastest growing segment of the United States population, with 40 million Hispanics alone becoming the nation's largest ethnic minority group. In general, because of the immigrant population gradually rising, their reasons to live a new and better life stands for their view of the open accessibility the land of opportunity has to offer, of which is the underlying benefits of access to healthcare. What is the basis of the U.S. healthcare system? The U.S. healthcare system is composed of numerous public and privately funded patchwork of fragmented systems that allow individuals to gain access to numerous resources and care. In better terms, to explain how the U.S. care system works, it can be simplified into 4 key points: access, quality and cost, equity, population health. For the first key point, access describes the ability of individuals to obtain needed services, although access isn't universally acceptable within the United States healthcare system, which can provide to be very difficult and show disparities among different groups of individuals. Quality. Quality describes the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. Healthcare costs is a big portion of the nation's economy. As costs are becoming a more prevalent issue, healthcare costs are increasing faster than wages, which means that an increasing portion of household income is spent on healthcare. Some of healthcare costs can be covered through insurance coverages only if the individual or family has access to it. Equity. Equity is the attainment of the highest level of health for all individuals. Achieving health equity requires valuing everyone equally, with focus and ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of health and healthcare disparities. And as stated by Dr. Steven Schroeder of the edited piece, "We Can Do Better, Improving the Health of the American People," he quotes, "The United States spends more on healthcare than any other nation in the world, yet it ranks poorly on nearly every measure of health status. How can this be? What explains this apparent paradox? From this basis alone, the U.S. lacks the beneficiary resources to supply universally healthcare to all individuals, such as undocumented immigrants, which they have little to no access to healthcare, which can cause a shift in the economy and the demographics of the United States population." Why is this such a prevalent issue of why undocumented immigrants have no access or little to no access to healthcare at all? First off, unauthorized immigrants, such as illegal aliens, aren't able to have or have no access to healthcare at all. With many immigrant families not being covered through health insurance, many of the individuals living in the household are solely relied on to provide funds and access to care. This becomes a striking issue for the nation entirely, as the U.S.'s demographics are comprised of many illegal aliens, which provide the cultural, social, and economic balance. Groups of families receive less and less preventative healthcare services and measures from which many of their families suffer through numerous health disparities and risks.
We're presenting this topic because unauthorized aliens are prevalent in the U.S. With such high numbers, we have to figure out a way to accommodate for them and provide healthcare services and resources to getting those healthcare services. It's also crucial to the nation's public health because limitations to health services and programs means that fewer people receive the care they need and lack the preventative care that's necessary for a healthy community. Now on to the learning objectives. Objective 1 is to identify the barriers immigrants face while trying to get health care. Objective 2 is to identify the negative outcomes due to the lack of healthcare for unauthorized aliens. And Objective 3 is to identify the various ways unauthorized aliens can obtain healthcare. So Objective 1, the difficulties that they face. One of them is not being eligible for healthcare, so they're unable to qualify for Medicare or Medicaid, and they can't get insurance through Affordable Care Act. 2 would be language barriers, so they have a difficult time communicating with health professionals and often feel frustrated, which creates misunderstandings, and individuals may not want to come back because they feel defeated. 3 would be just being uneducated about the complexities of the system and rules and regulations. The second objective is negative outcomes, the first one being health disparities. This includes a lack of health care, and having a lack of health care may lead to disparities such as birth complications or other things. An overall health decline because undocumented individuals have lower health levels due to stress, low income, and a lack of health care. And another negative outcome could be the possible spread of conditions and diseases, and this ultimately affects the community due to high prevalence of undocumented individuals working in food services and jobs that provide for our community, which again puts the community at risk if the health care is not provided.
Now moving on to ways to obtain health care. An illegal immigrant can apply for health coverage on behalf of a documented citizen. They can also purchase an unsubsidized insurance, and they do have access to the emergency room, but these fees may be very expensive since they do not have health insurance. And since these illegal immigrants don't usually get paid well, the emergency room is usually the last resort. Moving on to cultural competence. A healthcare professional's ability to provide care to an individual with diverse values, feelings, and beliefs is cultural competence in healthcare. The first point I'll be discussing is language barriers. So not understanding what the physician or anyone regarding healthcare is saying is due to the lack of language diversity on the healthcare facilities part. So if these undocumented individuals show up to the facility and they do not have a person to translate or an individual who understands them, this can lead to the individual not seeking that healthcare professional's help. Another point would be upbringing. So how the undocumented individual was raised and their knowledge on how to keep healthy. This may be difficult to change since they are used to a certain diet or natural remedy. Moving on to education level, undocumented individuals may or may not have the same level of education as others. So this goes back to their upbringing and the lack of knowledge on how to keep healthy. Now to a very important point is the undocumented individual's values and beliefs. Religion may come into play when discussing healthcare since many diverse religions have certain views when it comes to points like medication, sex, pregnancy. It is important that healthcare professionals show cultural competence when discussing with undocumented individuals with these diverse backgrounds, and this leads to my next point, which is trust. As an undocumented alien, they must be able to trust the individual that they are working with and know that they're secure in confiding in them. But if this individual that they are working with, the healthcare professional or physician, if they're not respecting the undocumented individual's beliefs or religion, this may lead for the undocumented alien to not trust the physician and not seek medical attention.
As for epidemiological data, 11.3 million individuals living in the United States are unauthorized immigrants. Breakdowns of this reveal 53% of immigrants come from Latin America and the Caribbean, half of this group being born in Mexico, 28% from Asia, 12% from Europe, 4% from Africa, and 2% from North America. As of 2011, 71% of unauthorized immigrants reported having no health coverage. Further, 47% of unauthorized immigrant children also reported having no health coverage. As of 2018, 24% of uninsured elderly individuals were undocumented immigrants.
A well-known concern about unauthorized aliens is that 39% of them has expressed fear about receiving medical services because of their undocumented status. Due to this fear of seeking and receiving health care, immigrants are unable to acquire proper medical and dental care along with prescription medicine and eyeglasses. Undocumented immigrants will oftentimes delay getting health care or choose not to acquire any at all. Mental health is also a concern among both undocumented adults and children because the adults may be full-time workers who receive little pay and no employee benefits. Seeking health care will cause them anxiety and fear because of their status. Children may also feel fear for their parents' safety regarding deportation or arrest because of their status.
Now we are going to talk about effective interventions that are in place that help unauthorized aliens. Interventions are a combination of program elements or strategies designed to produce behavior changes or improve health status among individuals or an entire population. However, due to many different reasons, those that are unauthorized individuals have very limited interventions in their favor. In order to aid unauthorized aliens, an intervention was made in 1986 saying that all hospitals must provide emergency care properly to any patient in need for medical emergencies. Not only this, but now 16 states are covering pregnant women regardless of citizenship status if they have low enough income. Some of the other limited and restricted interventions include California giving subsidized medical insurance for low-income unauthorized aliens who are the ages of 19 to 25, while also allowing children who are under 18 to get taxpayer-backed health care even if they are unauthorized. California is not only the only state to have interventions to help unauthorized aliens, but also in 6 states in the District of Columbia, they allow for children who are under 18 to have their Medicaid program covered regardless of their citizenship.
Throughout this presentation, we hope that you guys were able to see the barriers unauthorized immigrants face when getting health care, such as not being eligible for Medicare and Medicaid and not qualifying for the Affordable Care Act. Further, understanding the negative outcomes this causes, such as elevated rates of health disease in the community, and seeing the limited ways they can actually get health care, though emergency room visits or limited health centers. Overall, unauthorized immigrants in the United States lack access to health care, leaving them in a high-risk group for health outcomes. Despite some interventions that have been created, there is much more that needs to be done to allow for full health and safety of these individuals, regardless of their citizen status. Thank you for taking your time to learn about this health discrepancy.